Department of Mental Health is to support the clinicians that serve children across the state. We have 17 mental health centers, and we have clinicians. We have a children's director and a number of highly trained clinicians across the state. So in that role and supporting them, I feel like my role is also to make sure that they have the tools in their tool belt to do the best job they possibly can. And we work very closely with child welfare, and I've always prioritized this population as a population that we should, through our mental health centers, that we should prioritize when to address the needs. But our clinicians are fairly aware of some of the grief and loss issues, but it would really be good for them to really be able to pull everything together around the trauma, the grief, the loss, the abandonment, and to really fine-tune those skills and abilities as they work with children that are interfacing with the child welfare system. I've really received mostly glowing remarks or feedback about the training. Our clinicians have been really pleasantly surprised as far as how engaging it is and how it really opened their eyes to things that they thought they knew. So most of the trainings have been, all the feedback I've received have been very positive about the training specifically.
And so we've had very strong collaboration in South Carolina from our private providers, from everything from residential to therapists to any of our private practitioners, as well as we have a strong Department of Public Mental Health system, which some states do not have, and they have brought into it totally with us in partnership because they realize that a lot of the families that they're working with are families who are post-adopt or have been involved in the past with the child welfare system or are currently involved with the child welfare system. NTI has been a blessing for South Carolina. We had just came off of 2 years of trying to roll out trauma-informed systems of care information across the state. We had worked a lot on implementing signs of safety as some of our intake things, and we didn't have anything that really tied it all together. And so one of the things about this curriculum was that it offered that vehicle to tie together lots of different initiatives that we had worked on that otherwise it would be like initiative, and then everybody forgets about it. And this was a way of tying it all together and bringing it all together. So we, as we worked with the curriculum, we realized it was not just about adoption. It was about the whole life of a case through the child welfare system. That was the other thing that was interesting, was that we initially kind of drafted, voluntold the people who would be participating in the training. So we have directed adoption staff, post-legal workers, our licensing, and people that do home studies for adopted families, and we're kind of focused on that track. But as those folks started participating in that training, they quickly were providing the feedback of, this is not just about adoptions, this is about everything. Everybody in child welfare needs to take this. The other thing that was interesting is then we would have people contacting us, say, can we participate too? Because they were hearing such positive things from those who were participating in the pilot. I think another interesting thing for us was I think there was a little bit of a predisposition against, quote, online training, and that being an effective training model and that sort of thing. And this really was a paradigm shift for the policymakers within our agency of realizing the value that that you can do online training very well and very competently, that it's not a matter of just turning on the computer and walking off and going and doing something else and coming back and pushing the button and saying, okay, I achieved this. But that that online training could be used in a very interactive way. I think the impact has been more with some of our experienced people, interestingly. And even when you looked at our pre and post test scores in our state, our supervisors tended to have bigger gains in knowledge because they haven't been in school for 20 years. And once you're out there working, you don't have time to keep up with the new research and up-to-date stuff. And so really some of the more powerful messages I think came from our supervisors about, wow, I didn't know this. I wasn't aware of this. This is, so it's not something that, even though we're using it to onboard new staff, we're also going back this year and having every child welfare staff that did not participate in the pilot complete the curriculum because of so many comments that we got from experienced staff and experienced supervisors about this is some of the best training I've had since I've been with the agency. I've been in 30 years, not just child welfare, but the mental health field, that sort of thing. I've been involved in lots of different initiatives and many of them very good. But this is by far one of the most powerful and across the board and covers very many different areas. It's one of the best initiatives I've been involved in.